Good afternoon, everybody. I am Grégory Lambert. I'm a medical entomologist at the EYWA Mediterranean. I'm going to give you an overview of the entomological situation and the arboviral transmission in southern France. EYWA Mediterranean is maybe one of the oldest public mosquito control operators in Europe. We were created in the late 50s when the French government wanted to develop the Mediterranean coast for tourism. Thus, seaside resorts and cities were directly built from wetlands and swamps. And of course, this area was full of mosquitoes, and it was important to create a public mosquito control agency to prevent the nuisance. Indeed, the tourism is very important for the local economic development of our region. But between the Spanish and the Italian borders, we have about 70,000 hectares and can produce mosquitoes, especially Aedes caspus and Aedes detritus. Thus, we are about 150 people, mainly working on the field, which are necessary to react as fast as possible, especially during summers when the wetlands and hot temperature generate mosquitoes very, very fast. It was a huge challenge, but it worked. And globally, during the 45 years following the creation of EYWA Mediterranean, the entomological situation was under control. Of course, we use new tools, new techniques, new methods, more environmental friendly, but the nuisance was globally quite well under control. Things started to change at the beginning of the year 2000 with the appearance or reappearance of the West Nile virus. This virus circulates mainly among birds and generates economic or veterinary or sanitary problems when it moves from birds to mammals. It implies different species of mosquitoes, ornithophilic mosquito for the amplification, and both ornithophilic and mammophilic mosquitoes, which act as bridge vectors. It's complicated to understand how this virus circulates because 80% of the infections are asymptomatic, and most of the epidemiology of this virus is quite not well known. So the circulation of the West Nile virus started to become more frequent since 2000. We had some outbreaks among equids in 2000, 2003, 2004, 2006, and 15, 17, and of course 18, but I'm going to talk about this later. The situation was, as far as we know, was low-level circulation of the lineage 1, which touched mainly horses. You can see on the map that most of the circulation occurs in the wetlands of the Camargue area, and most of the time we have very small outbreaks, and nobody understands really why we have outbreaks one year and not another year. Globally, the epidemiology of the virus have changed. And it is quite obvious to talk about change in the epidemiology of West Nile virus because in the year 2018 we have a never-seen situation in Europe, and it also touched France. And this year we had human cases in the urban city, very far away from places where we used to have West Nile, and we also have appearance of lineage 2. So after this outbreak we had much more questions than answers on the circulation of West Nile. And is it important? Is it relevant to make some vector control? Should we move the surveillance from human to birds? What can we do, basically? And we know that the situation in the neighbor country was the same. We have to consider this problem of West Nile, not country by country, but of course at an international scale. But West Nile is not the only thing that changed in the situation in France, and we have a major threat following the introduction of Aedes albopictus in 2004 in Menton. You can see on the map that the species spread massively along the coast, and following the roads move farther to the west and to the north. The presence of the Aedes albopictus have a very important impact on the nuisance because this species is very urban, and it's always a problem when it's introduced somewhere. So we have some negative economic impacts of this area, and we have now a new species that can transmit new diseases in the country, like dengue, chikungunya, or Zika. And of course, there is important sanitary consequences at this introduction of this species. We had in France, since 2006, a surveillance and response plan to try to prevent major outbreaks of dengue, chikungunya, Zika, maybe one day yellow fever, or maybe more and more arboviruses in the following years. Because if Europe is not endemic for these diseases, we know that today we are now all very closely related to other countries or continents. And the risk of introduction of dengue in Europe is quite important. Of course, in France, we have some overseas territories which are very frequently infected with mainly dengue. And we know that the risk of introduction is very important. In mainland France, in regions where Aedes albopictus is present, the surveillance move from mosquitoes to the people, to the travelers. Everyone that came back from an endemic country with symptoms of dengue or chikungunya is reported by his general practitioner or by the sanitary office. They make investigation to know where exactly the people moved during his viremia. And at each place he moved and stayed, we make some entomological investigation to be sure that the vector is absent. If the vector is present, we conduce some vector control treatment. We try to react as fast as possible to reduce at the maximum the risk of appearance of autochthonous cases of this former tropical disease. And this response plan is very necessary in France, because you can see on the table that almost every year since the year 2010, we have cases autochthonous of dengue, chikungunya, and even Zika in 2019. You can also see that the number of cases is very low, which doesn't mean that the environment is not receptive for the circulation of the virus, which means we prefer to think that it means that the vector control measures which were implemented on the field were efficient. And it was the case because when we have the signal quite early, very few steps of the transmission, we have few cases. When we lose 2-3 weeks because the people didn't have symptoms of the infection, we move to 10, 20, less than 20 cases. And we know today that the circulation of Zika is also a possibility. And all this changed drastically the situation of the transmission of arboviruses in our country. We have new paradigm in the transmission of this disease. Because we have modification of the environment and the lineage we know circulate much more frequently than before without knowing why. Or we also have the risk of the introduction of new lineage like in 2018. And of course it's not a local problem. It's a problem of every country that is touched by this disease. So we need to learn from each other and consider this problem at an international scale. Of course, we have also the new problematics with the introduction of new vectors, and we know that new vectors will also be introduced during the following years. But today, we try to control the things as far as we understand them. But what I have to say is that we have more based on a curative measure, curative treatments, and we need to move to more preventive or proactive things. That's the aim of the EYWA. To develop the knowledge, to have new early warning systems. These systems would lead us to reinforce our surveillance when it's necessary, to prepare our response as early as possible when we know that we will maybe have a problem for the following weeks or months, and also to be much more efficient on the measure control we will apply, because we are prepared and we don't have to act fast as possible within 2 days or 3 days, which sometimes unprepared things. So I would like to thank all the partners of the EYWA project, and especially the NOAA, for the work we have done and the work we will do. And of course, I thank all of you for your attention.